Well, the world was a very different place 5 years ago. It came to a halt right around this time of the year as COVID-19 spread across the globe.
It was 5 years ago today, on March 12, 2020, when then Mayor Bill de Blasio declared a state of emergency in New York City. On the same day, the curtains went down on Broadway as then Governor Andrew Cuomo announced restrictions on public gatherings.
Sports leagues also came to a stop. The NCAA announced that all championships were canceled, including March Madness. In fact, all major sports leagues announced a pause as well.
More than 1.2 million people have died in the U.S. alone from the virus, but since then, so much has changed. Eyewitness News reporter Chanteé Lans with more.
From the long lines for testing to turning New York's iconic Central Park to a makeshift field hospital, the horrors of the height of the COVID-19 pandemic might not have rang more true for those working inside the hospital emergency rooms.
It was chaotic. It was very stressful, but we bound together as a team, and we made sure that we took care of our patients to the best of our ability.
Dr. Evangelos Lucas oversaw the medical staff at Northwell's Plainview Hospital on Long Island. What was it like for you making those rounds?
It was very difficult. There were lots of sick patients. There were patients that we saw one day and unfortunately they didn't see the following day.
More than 300 people died on Long Island in the first 2 weeks of the pandemic. That number growing to 9,000 in the first 2 years. The 5-year anniversary of the start of the pandemic comes at a time when there's a widespread upheaval at federal health agencies. President Donald Trump was in office back then and has regained his status now. His administration thinning the workforce for the CDC that would aid in the response to outbreaks.
Hearing that a lot of the people involved in putting these things together are losing their job is heartbreaking.
Dr. Adrian Popp is the chair of infection control at Huntington Hospital Northwell Health.
The identification of the problem may be delayed, and that's a huge deal.
For the medical staff, there were many lessons learned.
I think we leveraged a lot of technology. We brought technology to the bedside, telehealth services, remote patient monitoring. I would say those are the two biggest things that I can think of that impacted us positively here in the hospital.
In Plainview, Chanteé Lans, Channel 7, Eyewitness News.
Well, tonight, Eyewitness News will take a deeper dive into the 5th anniversary of the pandemic. We'll look at what we've learned and how the virus changed our lives all these years later. Join us for our special COVID Impact 5 years later, right here on Channel 7 and ABC 7 NY tonight at 5:30.